Hello and welcome to Afternoon Briefing here on ABC News. I'm Patricia Karvelas. Coming up, why hasn't Victoria turned the health curve? The CEO of Vic Health joins me later in the hour, but first, here are the stories we're following. Victoria records more than 500 new cases of coronavirus, the highest daily rise since the pandemic began, with the state's Premier pleading with people to stay home.
It's not a matter of blame, it's not a matter of judgment. These are the facts, and unless we see a change, then we're going to continue to see these numbers at an unacceptably high level.
New South Wales facing a critical month ahead, with clusters growing across the state. And the Prime Minister shifts focus for the COVID Commission to economic recovery and job creation.
This is an Australian plan based on Australian values, based on Australian challenges and Australian solutions.
There have been 6 more deaths in Victoria and 532 new cases of COVID-19 in the state overnight, which is a new daily record. There are now more than 4,500 active cases in the state. Today's record rise follows yesterday's deadliest day, where 10 people died in Victoria within 24 hours. Victorian Premier Daniel Andrews says that too many people are still going to work despite having coronavirus symptoms.
As it stands right now, we are seeing too many people, for whatever reason, attending work with symptoms. That just cannot continue. Otherwise, these restrictions will be in place for longer than they should be. And I'm sorry to say, we will see more people die.
New South Wales Premier Gladys Berejiklian says the state is holding the line against COVID-19. 17 new cases were detected in the past 24 hours. 8 involved returning overseas travellers in hotel quarantine. The source of one case remains under investigation. Ms Berejiklian says it's vital people remain vigilant and get tested if they feel unwell.
At the end of the day, it's up to all of us to keep getting tested if we have the mildest symptoms. If we're asked to stay home for 14 days, make sure it's 14 days, not 12, not 13, but the full 2 weeks, because this is critical in controlling the spread and making sure New South Wales gets on top of the virus so that we control the virus and the virus doesn't get in control of our state.
The Prime Minister, Scott Morrison, says it is inevitable COVID-19 will be found in aged care facilities when there is community transmission of the virus. More than 250 aged care residents in Victoria have contracted coronavirus, while more than 250 staff have also tested positive. Infected residents are being transferred to hospitals. Mr Morrison says it's important all Australians physically distance and adhere to health advice to protect vulnerable groups.
That those of us who may be in a less vulnerable position are continuing to follow the advice, performing the safe distancing and other practices about getting tested, about remaining isolated when you're a close contact. All of this is incredibly important because when community transmission takes place, it is inevitable that it will find its way into the more vulnerable parts of our community, and the aged care community is certainly one of those.
Dr Billy Stupas is a specialist doctor with the Royal Australian College of General Practitioners and works closely with the aged care sector in Melbourne, and he joins us this afternoon. Thank you so much for your time.
Hi Patricia, thanks for having me.
What's not happening right now? Why weren't general practitioners included in the newly formed Victorian aged care system that was set up last week?
That's a very good question. So we're not too sure as to why this is happening. What we are encouraging is for GPs to really be in the loop. In theory, we should really be part of this new aged care response team. You'd think as GPs as a fundamental group in caring for the aged care sector, and I think that's something we really are pushing for.
Okay, you're pushing for it. What reasons have you been given for the exclusion?
None that I'm aware of. None have been communicated to us as yet.
So what role do you want to be playing then?
I think a lot of GPs visit multiple facilities most days of the week. We care for many patients across different facilities. We want to know what the recommendations are. So they're telling the staff and contractors that they can't go to multiple aged care sites, but What about the GPs who have got patients across sites? We still want to see our patients. Obviously, we know telehealth is available, but there's nothing like popping in and seeing your patients and having a chat with them, especially in this hard time. We just want to be part of the plan. We are probably best in line to understand our patients' needs and the needs of the facilities. So I think it's prudent to be part of that team.
What information are you getting directly from authorities in Victoria? There's been a lot of reporting, as you know, about contact tracing, delays in contact tracing, inconsistencies in messaging. Do you think there is an issue around all of those things?
I think the department, DHHS, have been working well to get us information they can, but I think there's still a lack of information. For example, we don't know where the clusters are any sooner than the public would know, and I think that's something that you would expect GPs in the area to be made aware of, because that may help how I plan my consults, or what advice I give to the patients in the community, what things we might put out on social media to help.
So we know that GPs bill their patients through the federally administered Medicare benefits scheme. So what contact do GPs have with Victoria's Department of Human and Health Services? How does the interaction work?
Basically, if you have any questions, you're allowed to ask the question and get any responses back. Otherwise, they advise us. In regards to the way we get billed, yes, so some charge through the MBS, as you mentioned, and others charge privately. So that's ongoing. Obviously, the one thing that we are slightly concerned about is we're totally happy that the telehealth item numbers are there for us and available. However, in the aged care facilities, when you get a new patient, you can't see them by telehealth. One of the limitations is that I have to go face-to-face with and meet the patient and discuss the issues. However, with COVID, that's something I may not be able to do as often as I would like to, especially across multiple facilities.
We saw the numbers coming out of Victoria today, 532 new cases. This is after several weeks of lockdown. Are you surprised that they remain so stubbornly high?
I wouldn't say surprised. A lot of the models that we've actually had predicted today to be the peak of our coronavirus cases. So what will be interesting to see is what unfolds from here. But what this shows us is that the modeling's been right and people are doing the right thing. So we really encourage everyone to keep putting on a mask whenever they go outside. And obviously, if you have any of those respiratory symptoms like the runny nose, the fever, any chills, loss of smell, loss of taste, please go see the GP or call your GP and get a swab if you can, or one of the multiple testing centres.
The Premier wanted to drive home that message that the reason we're seeing transmission still, even after all of this long period of lockdown, is essentially because people go to work when they have symptoms. How do you change that? And what are you experiencing in terms of what patients are saying? I mean, are people worried about job security? Why are they making these decisions that are obviously leading to these adverse sort of health outcomes for the whole state?
I can't comment for everybody in the public, but majority have been doing the right thing and isolating themselves. However, always there's going to be a minority that ruin it for the majority. And one thing we're seeing is patients are calling us, they are asking for advice, they are coming in and asking for advice, which is something we really push for and are really happy to see. So all we can do is sound the Premier's statements, which are, if you are feeling sick at all, do have any symptoms, isolate yourself and get tested.
Let's go back to the aged care situation. As we've been reporting, 250 residents, also 250 healthcare workers. These are really high numbers for us. You provide aged care services. What is your greatest concern for the residents right now?
I'd say their overall safety and interactions with staff, because what's happening now is in the aged care sector, obviously they're putting in limitations to where people can work, so people can't cross multiple sites, which therefore means there may be limitations in the staffing for these patients. But I know the aged care facilities are doing what they can to find solutions to this. And unfortunately, again, being a GP in the community, I don't know what they're doing. I'm not part of that team, so I can't really comment on the details of that.
In terms of the way that this has been handled, we of course saw the European situation unfold before we had our own awful taste of what this looks like and a second curve, a second outbreak. Should we have listened to those lessons earlier around workplace mobility, around PPE in aged care settings? Are you disappointed that there has been what looks like a delay in implementing those sorts of changes?
I don't think so. I think everything in retrospect is very different. So I think at the time of where we are, we took the medical advice from our chief health officer and we did what needed to be done for that time. That's all I can really comment on that.
Let's just talk about the sort of situation for people, older people in aged care facilities. Many of them have Alzheimer's, of course, dementia, other complexities. How does that change the situation here? What considerations need to be made for those kinds of residents?
Absolutely. So that's a really good point. So what you basically have is areas of a nursing home that patients have got Alzheimer's with that should be isolated. However, these patients wander around. It's like they're home. They're allowed in the dining room, they're allowed in the lounge room. So obviously these facilities now are putting into place and already have put into place segmented areas where there are specific staff looking after those patients, specific cleaners. It's trying to basically contain that unit. And the last thing we want to do is isolate any members of these aged care facilities, because at the end of the day, that's where we worry about mental health and other issues occurring.
Is wearing PPE viable for all staff, especially for those working with residents who might be very confused right now, the sort of residents you were just talking about?
I think that's definitely something that needs to be done. So PPE is one of the most obvious things that we can do, and wearing the masks is something that has been definitely implemented across all the sites that I visit. And it's something I really encourage and applaud the staff, because at the end of the day, wearing a mask is hard work to do all day.
Yeah, it is. That's absolutely right. Look, residents in aged care are stressed and need emotional support and care. Families and friends cannot come. So who's providing this kind of support?
The staff that are there all the time. So this is one of the reasons that I try and visit my nursing homes, not just by telehealth. If I can get in there and go and have a quick chat with the patients, that's what we do. Nursing homes have got activities staff on board. I know the nursing staff really care about the patient's health and mental health especially. So they pop in, they say hello. It just takes a little bit of extra effort, but that's where a lot of the aged care facilities are trying to maintain good staffing levels.
You're also fluent in Greek. How can bilingual or multilingual GPs be better utilised during this pandemic? I mean, we've seen, of course, some Greek Australians become the latest victims over the last week of this pandemic.
Yeah, absolutely. So I think one of the biggest things is getting in there and talking to our patients and having a discussion with them about what's going on in the world. If that's something that their family members aren't able to come in and do, that's where we can step in with, being bilingual. We can do that and have a conversation, make them feel a bit more confident. We are out there listening, trying to do what we can for them, keeping them safe. I think as a family member, if I had a loved one in a nursing home, that's what I would want to be happening.
Separately, it's of course the flu season and it's pretty cold in Melbourne at the moment, although we're good, we can handle it, us Melburnians. There would be parents out there homeschooling and working from home. They're stressed and probably getting headaches and developing colds. How do you differentiate between being run down or actually having COVID symptoms, or are they just the same thing? No one can make that judgment themselves.
I think you're right on it there. I think no one can make that judgment on themselves. And I think that's where my biggest sympathy goes. We've got school mums at home with 3 or 4 kids running around like crazy, trying to homeschool. They might end up with a bit of a runny nose. But the problem is we might have a partner at home that's gone out to the shop. So we've got our kids that maybe went down to the Oval at lunchtime for a quick run. We don't know who they've come into contact with or who was running around at that point. So that's why we really encourage them, as hard as it is, to continue getting swabbed if you do develop any of those symptoms.
And finally, your organisation, the Royal Australian College of General Practitioners, received some really sad news today. Your national president, Dr. Harry Nespolon, has passed away. Now, he played such a critical role during this pandemic in raising issues on behalf of GPs and their patients. How is he being remembered today by your colleagues?
Yeah, it's devastating news, actually, to hear today. Look, Harry strongly believed that GPs are the foundation of Australia's health system and they needed to be treated as such. Harry will be known for working tirelessly to advocate for Australian GPs and the general practice as a profession. So he will be remembered for a long time coming, and our condolences to the family.
Dr. Stupas, thanks for joining us on the show.
Thank you, you're welcome.
Dr. Billy Stupas is a GP in Melbourne's southeast. For business news now, Sue Lannon joins us from Sydney. Sue, the consumer watchdog is taking Google to court.
Yes, so the consumer watchdog, the Australian Competition and Consumer Commission, alleging that Google misled consumers into giving them more personal information than they thought they were giving. So the ACCC in this case seeking fines in the millions of dollars. So what they're alleging is that back in 2016 there was some privacy changes that Google asked consumers to agree to on an optional basis. The ACCC says consumers did not provide what it calls explicit consent, so people were misled into giving Google access to their non-Google web browsing as well, so browsing on other internet sites and using other browsers, but Google collected that information and used it to target ads to consumers. So for its part, Google says it strongly disagrees with these claims from the ACCC and it plans to fight the case. Now it says that its view is that these notifications provided in 2016 were easy to understand and clear, and it's saying it did not mislead consumers. PK. So yet another case taken by regulators against Google, so it will be a very interesting case to watch.
And gold has reached a record high.
Yes, now this is because of the very heightened political tensions at the moment between the US and China, and also between Australia and China. You've also got a weaker greenback, which is pushing up gold, and of course rising coronavirus cases. So no surprise that investors are turning to a safe haven. So we saw the spot price of gold rise as high as $1,944 an ounce earlier today. It's since slipped back, now buying around $1,936 an ounce, but still it's the highest price since September 2011 when gold reached $1,921 an ounce. So expected to keep rising. That really boosted gold stocks on the Australian share market today. We also saw tech stocks rise as well. So in the end, the ASX 200 rose about 0.25% to 6,039, but was a very volatile day of trade. Other stocks going up include Lynas. So Lynas is a rare earths miner, and they've just signed a deal with the Pentagon to build a processing plant in the US. So their shares soared about 11%. But some of the stocks going down include Insurance Australia Group and also Estia Health. So they're one of the aged care providers in Victoria, which has seen rising COVID cases. So they told the market today that 2 of their aged care homes have they've been ordered basically not to take any more residents until those aged care homes are declared COVID safe. So not surprisingly, Estia Health shares fell today. And the Australian dollar is also being boosted by the weaker greenback PK. It's buying around 71.3 US cents, and that's finance.
Thanks, Sue. And in breaking news, tomorrow's Black Lives Matter protest in Sydney remains an unauthorised event after organisers lost an appeal in court. New South Wales Police yesterday won a Supreme Court battle to prohibit the rally, arguing it would breach public health orders. Organisers this afternoon appealed that decision, claiming the court did not have the jurisdiction to hear the police's application. But the Court of Appeal did not accept that argument. A protest leader has previously said the event would go ahead even if organisers lost today's appeal. Well, the Victorian Government says it will consider closing abattoirs and other high-risk industries if coronavirus continues to spread through vulnerable workplaces. There's been another record rise in COVID-19 cases, with 532 new infections confirmed overnight. ABC analyst Casey Briggs joins me now. Casey, welcome. What's going on in Victoria? There was so much hope that by now the numbers would be lower, but today's the highest daily rate. What's happening?
That's a very good question, and if I had a great answer for you, I probably would be out there fighting this pandemic as well. 532 cases today. You're right, we saw a bit of levelling off, particularly sort of late last week, over the weekend, where numbers didn't go down, but at least they weren't sort of on a trend basis going up. The last 2 days have turned that back into an upward trend, so 532. The slightly concerning thing as well, as well as it being a record number today, is those 532 have come on a day with relatively few test results actually reported. And if you look at the percentage of all of yesterday's tests that came back positive, we're talking at 532 out of 17,500. You're looking at a positive test result rate of about 3%. And aside from some very early days when there wasn't very much testing happening in Victoria at all, that's the highest number that we've seen there. This is a number that governments track, the World Health Organisation tracks, as a way of just measuring, are you catching enough of the virus? How much are you missing, among many other things? Now, don't read too much into this. It is just one day in a very long pandemic, but we do want to see this come down again, and particularly want to see the testing numbers going up again. The Victorian government is particularly concerned still that this spread is through workplaces, abattoirs, meatworks, warehouses and the like, and aged care. Let me show you this chart, which shows you the number of infections among residents of nursing homes across the country each day. And you can see this is a curve that is a long way from flattening. 37 yesterday. We haven't had an update on that today, but we're seeing 20, 30, 40 or more infections among aged care residents every day, and that's a very bad sign for the ultimate death toll in those families. We don't want to see these numbers to continue to grow. The workplace spread, the aged care home spread, is one of the reasons I think that the government is resisting going to further lockdowns, because they're not going to have an impact necessarily on workplaces. One thing that maybe supports that line of thinking is the number of community transmission cases, those unknown source infections, has really come down off a peak of a few weeks. It's bouncing around a little bit at the moment. It's a bit hard to tell if it's going up or down, but it certainly is lower than the sort of high numbers, 3-digit numbers of unknown source transmissions that were being sort of reported each day. It'd be great if we could say this means that, yes, the chains of community transmission are being extinguished by the stay-at-home orders, and it is just workplaces that we need to worry about now. The only reason I don't think we can say that is because there is a massive backlog of cases still under investigation. At the moment, more than 2,800, and that number hasn't updated yet today, so I expect it will go up again. We just don't know anything about those cases. They may end up here. They may end up linked to known clusters. We just don't know. There's a lot we don't know about how this virus is spreading, and that makes it very hard to work out exactly what's going on.
And Casey, how about the rest of the country?
Well, the rest of the country, I mean, every other state, bar New South Wales, is continuing its very small numbers, 0, 0, 0, 0, and we haven't had updates from 2 states yet, and 17 out of New South Wales, which is broadly holding the line. It's sort of status quo at the moment. Of those, 8 were hotel quarantine cases. The rest were local transmission, which is broadly consistent with what we've been seeing for the last couple of weeks. Some of the clusters that have been concerning in New South Wales appear to have been brought under control, or at least not many cases are being linked to them anymore, while others are now growing, and the perimeter of those clusters, the number of sites where there's been exposure, is broadening to more restaurants, to more churches and to more schools. And so this is sort of the holding pattern that Sydney is in. Hopefully we do get control of it soon, because the longer this goes, the more potential sites of exposure, the more likely it is that you end up with just enough cases getting missed that turn into a problem. There's every case that gets missed, there's a certain chance that it lands in a problematic or a high-risk environment and takes off like a wildfire. So really, we want all these loose threads to be brought under control soon. We can't keep doing this forever.
Thanks, Casey. That's ABC analyst Casey Briggs. There are no new cases of coronavirus in Queensland in the past 24 hours. Further border restrictions have been introduced overnight, banning visitors from another hotspot in New South Wales. Anyone who's been to the Western Sydney suburb of Fairfield in the past 2 weeks will be refused entry into Queensland. The restrictions also apply to anyone who has visited the Campbelltown or Liverpool areas or all of Victoria. Premier Anastasia Palaszczuk says delays at checkpoints will be unavoidable.
We'll have those really tough measures at the border, with those that extra hotspot of Fairfield being declared from today. And of course, there will be delays at the border. I can't do anything about that. There will be delays because we are protecting Queensland. And I do want to thank everyone there on the borders who are doing an amazing job keeping Queenslanders and all Queenslanders safe.
A growing number of legal experts are calling for the age of criminal responsibility to be raised from 10 to 14, saying Australia is out of step with international standards. Australia's Attorney Generals met today to discuss the age at which charges should be laid. But at the end of today's meeting, the AGs have decided more work is needed to understand the alternatives. New South Wales Attorney General Mark Speakman says more work needs to be done in identifying alternatives to the criminal justice system, with a report to be delivered to the Council of Attorneys next year.
What are the therapeutic interventions, the behavioural interventions, the social support, the educational interventions that offending children need if they're not going to be dealt with by the criminal justice system? So that further work is to be done and will be led by Western Australia. I should note here in New South Wales that as of a day or two ago, we had 200 young people in youth justice centres in detention in New South Wales. That is down about 1/3 over 4 or 5 years. And while occasionally there are very young offenders in youth justice centres, at the moment there are no 10, 11 or 12-year-olds in youth justice centres in New South Wales, and we have 3 13-year-olds in youth justice centres in New South Wales. So the overall trend in New South Wales is promising. We are having fewer and fewer children in detention. And certainly New South Wales views detention as an absolute last resort for young offenders.
I want to bring in my afternoon panel, Liberal MP Trent Zimmerman and Shadow Assistant Treasurer Stephen Jones. Welcome to both of you.
Good afternoon, PK.
I actually want to pick up on the age of criminal responsibility a bit. It's probably something you're not both focusing on intensely, but I think it's a really important issue. And it seems that, the can has been kicked down the road today by Attorney Generals. That's how I see it. Trent Zimmerman, should we really be holding 10-year-olds criminally responsible? Do you think the country needs to look at this issue?
Well, look, it's not an area where I'd claim to have any great expertise, but instinctively I agree with the proposition that you're putting. It doesn't sit comfortably having 10-year-olds treated that way. I'm interested to see what more work the attorneys have commissioned, but it would be good to get a resolution to this issue one way or the other, I would have thought. But as you know, it is primarily a matter for state and territory governments because most of the criminal justice system falls within their jurisdiction.
Yeah, no, look, that's absolutely right. That's why the Attorney General's met on it. Stephen Jones, should we be setting that benchmark at 14? I mean, there are many Labor governments at a state level that will have to be making this call. Should WA and Queensland be moving in this direction?
Look, I think the Commonwealth does have a role. It's a role to lead. It's hard to think of a policy more specifically designed to harm the life outcomes of young people than sending them to jail. It's more expensive. It costs over $1,000, closer to $1,500 a day to have a person in jail. We know that their life outcomes are going to be ruined as a result of it. Rehabilitation outside of institutional setting has got to be the option that we are looking for, and I think the Commonwealth should be leading. And let's not forget, if you're a young Aboriginal boy or young woman, you're more likely to be one of those kids who are being sent to jail, furthering the inequality in life outcomes. So let's turn our mind to a way that we can build this into a national program at the same time as looking at Indigenous incarceration targets as well. Commonwealth absolutely got a role to lead. Yeah, and you're also less likely to have parents that are able to argue your way out of it as well. As we know, that's one of the more disturbing parts of the system. Look, I want to talk about coronavirus. I know you're both from New South Wales, but I want to start off with the situation in Victoria. Barnaby Joyce has called for the Morrison government to step in and take charge of Victoria's management of the coronavirus crisis. Start with you, Trent Zimmerman. Should there be federal intervention?
There should be federal support, but I don't think there's a case for federal intervention. And that federal support is obviously flowing in bucket loads at the moment, be it the 1,400 Defence Force personnel that we have down there or the support that we're providing to the tracing capacity and marshalling the other states to help with that. Look, there will be clearly lessons to learn from what's happened in Victoria, and other states will be looking at closely as to how Victoria responds to those, because they will need to learn the lessons themselves. But I think it's a mistake to think that the Commonwealth itself has an army of contact tracers and health officials that are hidden away somewhere that could be deployed overnight to replace Victorians doing that job. We will supplement and support where we can. As you know, the Prime Minister has an open door to any request from Dan Andrews or other premiers, and he's saying yes when he's asked. That's the important thing at this stage of the pandemic.
The state's Premier Daniel Andrews said he will look at closing certain industries if the workplace transmission of coronavirus is not slowed. I wonder, Stephen Jones, is that something that should have happened already? If we know workplaces are one of the places that this happens, and we've got over 500 numbers today of new cases, is that something that needs to happen?
I've just actually come from a briefing on this particular issue, Patricia. There's been over 120 workplace clusters in Victoria. We shouldn't feel smug in New South Wales. There's a growing number of workplace clusters in New South Wales as well. I think we've got to get to the root cause. I think swift action to close down, to clean, to identify the source of the infection, absolutely 100% support that. I think we also need to be looking at the cause of how a disease does spread within a particular workplace. We know that high levels of casualised, low-paid workforces, we know that high levels of casualised, low-paid workers are exactly the areas where people are too poor to be able to stay at home. So we need to be able to support those workers to ensure that they can do the right thing by everyone, by staying at home if they're sick or showing symptoms or have an adverse test. I think more needs to be done in those areas. But can I just say one thing about Barnaby's unhelpful intervention? Firstly, cooperation is going very well. Secondly, it's not like the Commonwealth doesn't have an area of exclusive responsibility in the area of Victoria as well, and that's in the area of aged care. So if the Commonwealth wants to up its level of intervention in any state or in any area, I think it's in the aged care area where we know the risks are highest. And once it gets in there, it spreads like wildfire. So if Barnaby wants to be helpful, perhaps it can be focusing on the areas where the Commonwealth has explicit and almost exclusive responsibility, and aged care is one of them.
Yeah, Trent, it seems that aged care, of course, where this is spreading, and it's really sad, we can expect more deaths in coming days and weeks. We know it will happen. We've been told it's going to happen. It's a very, very dark time in Victoria, but I think all Australians feel a sense of sadness around all of this. Shouldn't we have been better prepared? I mean, there is a federal responsibility too with aged care, PPE, the mobile workforce, aged care workers being able to come in and out of different aged care homes. Aren't these things that should have already happened by now?
Well, I think they have been happening, and it's a continuum of ramping up based on what you see happening, based on infection rates and so on. So, for example, I think 2 weeks ago, the Victorian Government and the Commonwealth agreed that masks should be compulsory in aged care facilities. We have been providing, I think, 5 million masks to the aged care sector in Victoria alone. So there's a continuum of responses based on the level of community transmission. But what is really difficult, I think, in relation to the aged care setting is the fact that obviously someone can be working in an aged care facility without any symptoms but still be transmitting coronavirus. Now, it's less likely than when you are symptomatic, but that's possible. And that's, I think, one of the great challenges that the sector has faced both here and overseas.
Just talking about places, of course, where the virus can spread, organisers of the Black Lives Matter protest are pretty upset because it's an unauthorised event according to the courts. I want to start with you, Stephen Jones, on this question. Do you think that's reasonable? Should the protest should it be able to go ahead? What's your view?
Look, I 100% support the objective of the protesters, which is to put a spotlight on inequality, to put a spotlight on injustice in respect of Australian First Nations people. But I don't agree that when we have a pandemic spreading through the community, when the risks are so high, that this is the best way for us to be doing it in this particular month. So I'll be showing my support in whatever way I can. but I didn't attend the last one for this reason. I won't attend the next one for this reason. 100% support the cause, but we've got to find another way to conduct our protest, to conduct our advocacy during this pandemic period.
The organisers have said the event will go ahead despite the court's ruling. Is that a mistake, Stephen?
Oh, look, I think it's unfortunate. I've said what my view is. I understand the passion. I've listened to all of the interviews of the organisers. I admire the passion, I admire the conviction, the single-mindedness of it, but I disagree with the conclusion. I don't think this is the best way for us to be getting our message across, for them to be getting their message across when we're in the middle of a pandemic. Find another way. You have my 100% support for the cause, but I don't think we should be getting large numbers of people together in the middle of a pandemic. Too risky.
Trent Zimmerman, the court may have said no, but it seems that organisers still want to go ahead. Do you understand, or do you have some sympathy for their desire to get on the streets and make this point at this particular time in history?
No. I admire their passion for a cause, and obviously the right to protest is an important part of our democracy, but it's outweighed in the current circumstances by the risks involved. And the court decision should be enough, but more importantly, court decision or not, it's the consistent advice from all of the health experts in New South Wales that this is a risky enterprise. This isn't politicians making that judgment, it is our health professionals making that judgment. And no planning in the world can overcome the fact that a protest by its nature is very hard to be an environment in which you can force proper social distancing. So I think that the advice of our health officials should be followed. And I would just say to the organisers, please, please, please think about other ways in which you can make your point. We saw earlier this year our veterans who wanted to honour their fallen compatriots had to reinvent themselves in terms of the way that they honoured Anzac Day. And they did that really effectively. There is more than one way to protest in our democracy, and we need that to happen at this time more than ever.
I just want to move to the economy before I say goodbye to both of you. Trent Zimmerman, still with you. Some of your Liberal colleagues are pushing to bring forward personal tax cuts. Do you think that would be a good way forward to get more money in people's pockets and get the economy moving?
Well, as a matter of principle, I'm always attracted to personal income tax cuts, and that's why I've supported the plan that we have to reduce income tax over the next couple of years. But I think what the PM said quite rightfully is that our priority has to be about employment generation over the next 12 months and probably for longer. There's no point in income tax cuts if you haven't got an income, which is why jobs has to be the number one focus. So I think everything that we need to do needs to be within those parameters. Now, of course, income tax cuts would have some stimulatory effect, but there might be better ways to be spending Commonwealth resources just at this point in time.
What do you think on that issue, Stephen Jones? Do you still support a call that we've heard before from Labor before the pandemic that some of these tax cuts be brought forward?
We'll look at it, and we've already said in relation to the second tranche, which is to low and middle income earners, that there may be some merit in that. But I do want to make this point. On Thursday last week, the government released the budget update, $84 billion worth of deficit this year, $185 billion deficit next year, the debt approaching $1 billion. The Treasurer said in response to questioning on this that he was taking his inspiration from Ronald Reagan. Ronald Reagan doubled the budget deficit. He doubled the government debt during his time in office, and he did it because he was so wedded to the ideology of tax cuts at the same time as the needs upon the budget are going to be greater now than they have been in a long time. Now, we were just talking about aged care. We've just had a Royal Commission that says there is not enough money in the aged care sector. We know that one of the reasons that the virus is a higher risk factor in aged care, quite apart from the frailty of the residents, is that there are a lot of low-paid casual workers in that sector because there's not enough money in the aged care sector. So I think we've got to be very, very careful about saying we're going to have a tax cut-led recovery. A lot of very serious economic thought says it won't work this time. But secondly, we've got budget deficits growing, government debt growing. How is a tax cut the answer to meeting the immediate needs of the economy and the medium and long-term views about bringing that budget back into surplus? Taxes should not be a cent higher than they need to be, but we need to look at both sides of the equation. How are we going to pay for our ageing population? How are we going to pay for the nation-building projects? How are we going to ensure that that generation of young people who are leaving school now, that the Productivity Commission has identified will be scarred for life if they do not find their ways into jobs in the next 2 years? How are we going to stave all of this off? I'm convinced it's not through a voracious campaign of tax cuts.
Thank you to both of you for joining us this afternoon.
Thanks, Patricia.
It's Liberal MP Trent Zimmerman and Shadow Assistant Treasurer Stephen Jones joining us this afternoon. Well, returning to our breaking news this hour, tomorrow's Black Lives Matter protest in Sydney remains an unauthorised event after organisers lost an appeal in court. Ursula Malone was in court for the decision and she joins me now. Ursula, what happened?
Well, just a few minutes ago, the New South Wales Court of Appeal, there were 3 judges sitting on the bench today to hear this appeal. The organisers came to court. They argued that they'd been denied procedural fairness and that there was an apprehension of bias. Some of the grounds they gave were, they said that the New South Wales Assistant Commissioner, it was up to her to make the decision about whether to go to court to try to stop the rally going ahead. But they said her superior officer, the police commissioner, had already been on radio that morning and he'd made his position quite clear that he'd already said that the matter, they were going to challenge it in the court. So the argument was that there was a bias in the decision-making and their clients had been denied fairness. Now, the judges dismissed that argument and they dismissed the appeal. That means that yesterday's decision by the court prohibiting the rally stands.
How have the organisers responded to this ruling?
Well, they haven't been here at court today. This morning they have said they have insisted that they will go ahead with the protest. They're also saying that they believe they can do it safely. Like, one of the grounds the judge gave yesterday in granting the police a prohibition on the rally was that given the upsurge of cases in Victoria, they said that there's a real risk that that we could see a similar thing happening in New South Wales. They said New South Wales, while there's a low level of community transmission at the moment, the state was balanced on a knife edge, and that was one of the grounds the judge gave for granting the police the prohibition against the rally. So the organisers this morning were saying that in their view they thought they could still go ahead safely. They want to move the rally to the Domain, which is a large, wide, open space. They said there'd be enough space for people to spread out and not to gather in groups of more than 20. And they'd also, the message they were giving to people who wanted to go was wear masks, don't come on public transport. But they were insisting, they said that their cause is an important one and that they need to get out there. And they said even in the times of a pandemic, this was a cause that they still felt that they had the right to go out and protest about.
Thanks so much for your time, Ursula. That's reporter Ursula Malone reporting on that breaking news that tomorrow's Black Lives Matter protest in Sydney remains an unauthorised event after organisers lost an appeal in court. Well, as we've been covering this afternoon, coronavirus cases have hit another record high in Victoria and there have been more deaths recorded in the state too. My next guest this afternoon is the Chief Executive of Vic Health, Dr Sandro Di Maio. Dr Di Maio, welcome.
Thanks for having me.
These are very high numbers that have been reported today. There is a sense of collective, and I feel very comfortable using this language, collective grief, I think, in Melbourne today, that despite a lot of effort and trying to stay at home, we haven't turned this around. What's your reaction when you heard today's numbers?
Yeah, look, the numbers today are disappointing, they're frustrating, and I think you're right, we do have a shared sense of grief, and I think we saw that even among our leader here in Victoria, the Premier, this morning. This is proving to be difficult, and we haven't yet turned the corner. Having said that, there is some good news. We do know where the majority of cases are currently occurring, that is in workplaces. There are things that we can do and are being put in place to try and reduce that spread. And I suppose we just have to keep reminding Victorians that we're not out of the woods. This is a tough situation, but all of those same restrictions need to continue to apply. We need to stay home, stay masked, wash our hands, and get tested if we have any symptoms.
Okay, but they're all the messages with respect that we've been hearing now for several months, and yet we've had 532 cases today. We know workplaces are one place where this spreads. Has the case now been made to shut down some of these places, abattoirs, construction sites, to try to actually really drive these numbers down?
Yeah, well, look, the Premier and the Chief Health Officer in the last 48 hours have said that nothing is off the table when it comes to limiting the spread of the virus. But these, we're talking about important frontline pieces of infrastructure. These are parts of our food system, they're parts of the logistics system. To shut them, many of them have been shut down if there have been any cases of the virus whatsoever, but to go that extra step to make a blanket rule, I think they're understandably taking a very cautious approach. But the majority of cases at the moment are in aged care. There's been a national emergency response set up, run in conjunction with the federal and state governments. And the other is, as I said, in workplaces. And there have been, measures put in place to make sure individuals don't have to choose between staying home and putting food, getting tested and staying home, putting food on the table. There are much clearer guidelines and, more and more testing spots across the state to try and reduce those risks.
You've been really pushing, and I have too. It's not only the law, but it's important, I think, just morally, to be wearing a mask wherever you can. Just to be clear, I don't wear it on TV, neither do you, so people can read our lips. But
well,
we'll both,
home, Patricia, so that's right.
We'll both be putting our masks on. What's the time frame for making the determination about whether that strategy is going to work before further measures might be necessary?
Yeah, sure. And this is really one of the tough things about this virus. It will take probably at least 2 weeks to see whether we've made a clear difference from any major new measure we put in place. So 2 weeks from lockdown, 2 weeks from the masks. And that's just to see, early signs of case changes. We probably won't see those cases come down to single digits. Some experts are saying for many, many weeks, even if when we continue to commit and do all of those right things. What is concerning though, and we need to make sure we don't lose hope, because this is the way it's just going to happen, is that the people being hospitalised the delay between taking measures and then seeing those hospitalisation numbers come down, that could take between 2 and even 8 weeks, and then finally the death rates coming down based on other countries around the world. That can even take 2 or 2.5 months to start to come down. So there is a delay between putting these restrictions in place and starting to see the benefits. And that's a big challenge, I know, for populations, because we want to see the benefits straight away. We want to see what we're doing works and have that positive reinforcement. But unfortunately, it is a long game. It's an important one, though, and we need to stick with it.
You say between 2 to 8 weeks, which you're right, I'm an impatient journalist, so that seems like a really long time to me. So what do we do in those 2 to 8 weeks to hold our nerve? What are you worried might happen at a sort of population level in relation to behaviour in that time frame?
Well, I think there are a number of concerns. First of all is that we're, starting to feel a bit numb about the numbers and the messaging. So today we've seen a new sort of more road accident type, very confronting series of messaging and adverts being released by the government, really trying to step up that messaging. We've seen the broadening of messages in multiple languages to try and reach further into the community, the utilisation and really the engagement of community leaders to make sure it's a bottom-up approach, not just a top-down from government. That's critical to maintaining these measures over the long haul. I think it's the continuous engagement with the community, the important work that media like yourself is doing to keep people informed, but it is going to be difficult. Trying to stick with something, difficult, and frustrating set of measures for a long time before we potentially see those benefits. We're going to have to, find a way together to get through this. And I think even things like having to choose, as I said, one of the big concerns that has come to light, is the fact that many people were going to work after they had been tested simply because there were economic concerns about putting the food on the table if they missed that day of work. And so, government has had to respond by putting then financial hardship payments in place. So, as we're seeing some of these barriers, some of these things that are getting in the way of people doing the right thing or sticking with those restrictions, we're having to put new measures, the government and the Chief Health Officer is having to address those. It is going to be, a tough long haul for Victoria.
It really is. So I know you're not here to make an announcement that's ultimately on the basis of the advice that's provided to the Premier, but I think it's fair to level with people too. I've, looked at the trend and looked at what's happening. It seems to me very unlikely that this lockdown's about to end in a couple of weeks. Should Victorians watching, of course we're national, but the Victorians watching probably in higher numbers because they are in lockdown, should they be prepared for a longer period of restrictions?
Well, look, I just want to reiterate that I'm not the Chief Health Officer and I'm not the Premier. That's their role to make those calls, and they will be making those calls based on the latest evidence on the epidemiology, on where they know the virus is spreading, and of course on the enormous amount of researchers and experts and public health experts here in Victoria advising both of those leaders. But I think they've been very clear with Victorians and Australians that if we're not, if it's not safe to ease those restrictions will have to continue. That lives come first, and that the hardship that these restrictions on Victorians place, the very real hardship, economic and mental health and physical health hardship that they place. I don't think anyone is taking that lightly. This is a very, very tough line to walk, and I think they're reassessing that decision on a daily basis, but that rests with the Premier and the Chief Health Officer. Yeah.
Look, you're the CEO of Vic Health, so you do take a much more macro view of health. It's not just, responsible for the pandemic. What kind of consequences is this current lockdown and crisis in Victoria having on people's mental health? Because mental health is the other part of all of this. And we all know anecdotally in Melbourne that people are very, very gloomy at the moment. I feel very comfortable saying that based on many conversations I've had professionally and personally. How big an issue is this?
Yeah, it's a huge issue, and that's really the other side of the health impacts of the pandemic. I mean, being stuck inside, many people are on their own. They're isolated from friends and family. Think about older people. Think about people who are sharing a house. People who are unemployed or looking for work. People who have kids at home. And are trying to homeschool as well as everything else that's going on at the moment, or indeed people who have loved ones who are in the older demographics who, are at most risk from the pandemic. This is affecting the mental health of Victorians and Australians, and I think it probably will for a long time. And certainly part of the recovery, as it's also been a big part of the response, has to be on supporting the mental health of Victorians. All of the usual services, the important services, Beyond Blue and Lifeline, all of those are available and have increased their capacity to be able to respond to what has been an incredibly, continue to be an incredibly difficult time for mental health of Australians and Victorians.
Dr. DeMeo, thanks for joining us.
Thank you.
And that's the CEO of Vic Health, Dr. Sandro DeMeo. Aboriginal and youth activists were hoping today's meeting of the Attorneys General of every state and territory would put Australia in a historical position, but it hasn't worked out that way. Various groups have spent years campaigning for the minimum age of criminal responsibility to be raised from 10 up to 14. But at the end of today's meeting, the Attorney Generals have decided more work is needed to understand the alternatives. Indigenous Affairs correspondent Isabella Higgins joins us now. Isabella, what do we know? What have they decided?
Well, Patricia, I think what came out of this meeting today wasn't entirely surprising. Going into this meeting, we did know that many of the state representatives went into this with quite opposing views, that some state attorneys generals were much more for this and others who were quite opposed. In some circles, this idea of raising the age of criminal responsibility from 10 to 14 is seen as quite controversial, although advocates would say it's far from that, seeing as this is the standard in many other developed countries around the world. So shortly after that meeting, we heard from the New South Wales Attorney General, Mark Speakman, and he says that this council listened to the latest from their working group who have been looking into this issue, that they've considered it, but that the council would like to hear more about what alternative sentencing options are available, what the alternative regime may look like if you do stop criminalising these young children for their actions. And that work, it's not expected to be finalised, to be handed down until 2021. So for those advocates who were really hoping today was going to be the day for change, it seems like it's a long way off yet.
Isabella, we'll be speaking to you again next week on Wednesday for our regular segment. Thanks for coming on.
Thank you.
We will be talking with Isabella on Wednesday for our regular segment on amendments to the National Closing the Gap commitments too that have been agreed on, that have gone to all, of course, the state and territory leaders. Well, with sport back on the national agenda, let's bring in ABC commentator Tony Armstrong. Tony, hello.
Hey, PK.
Fill us in on the Pies versus the Eagles.
Yeah, so that was probably the big game out of yesterday's clashes. And, well, the Eagles, they've roared back into form, beating the Magpies by 66 points. That puts them into fourth position on the ladder. They're flying, given the next few matches that they'll have over there in the Perth hub. The Pies kicked 4 of the first 5 goals of the afternoon, and then, well, it was all the Eagles after that. 17 of the next 18 goals went the Eagles' way. Josh Kennedy kicked 7 goals, and their midfield really got on top with Tim Kelly, the boom recruit from Geelong, dominating in the midfield, and Nick Natanui tapping it down his throat all afternoon. Scott Pendlebury for the Pies was a late out. It's looking like he might be out for anywhere between 2 to 4 weeks. So he joins Jeremy Howe, Steele Sidebottom, Jordan De Goey and Travis Varco on the sidelines. So it's going to be a tough little slog for the Pies in the not too distant future, but the Eagles are certainly looking like they're on the up and up.
And Tony, how are the players handling the WA hub?
Yeah, so it's pretty interesting. Only as of Saturday, the players who are outside their home states, they're not even allowed in their teammates' rooms when they're staying in the hubs. So just another added restriction placed upon them, of course, keeping the players unaffected by COVID-19 of the highest priority. So just another layer and another thing that they have to deal with as they continue to try to get this season away.
Tony, enjoying lockdown?
Me? How am I enjoying it?
Yeah.
I'm not. I'm struggling, PK, but I'll get through it just like everyone else will, I think.
It's okay. We'll Insta-story each other later. We'll be okay. Thanks for coming on.
No worries.
That's ABC commentator Tony Armstrong. Remember, you can keep up to date at news.abc.net.au and on iView as well. That's afternoon briefing for today. More on our top stories up next. So stay with us here on ABC News. I'll be back here at 4 p.m. tomorrow for more of afternoon briefing. Stay with us here on the ABC News channel.
In the season finale, we're heading to Victoria's High Country, a remote, spectacular place where the women are taking the reins.
What do the blokes around here think of it? Don't ask.
There's been fires come through. It's a very resilient community.
People support one another. Just shows what a friendly bunch of girls we are.
Backroads, tonight at 8 on ABC and iView.
On Q&A, more financial support is on its way. So who will benefit? Will it be enough to keep our hardest hit sectors afloat? This ongoing health crisis is punishing our economy, meaning recovery will take longer than first predicted. It's a difficult time for businesses and so many without work. But how long can this assistance go on for? Send your video questions, share your stories. Join us for Q&A.
Q&A.